Accommodations and test results. Effects of using accommodations on high-stakes testing. Jennifer G. Erxleben, University of South Carolina. With an increase of special education services continuing to rise each school year, the need to include accommodations for those testing has also increased, leaving many educators to wonder if accommodations affect the test scores, and if so, are the test scores and accommodations valid, reliable, and fair? High-stakes testing. High-stakes testing is used to assess the knowledge and skill level of students and hold teachers, schools, and districts accountable for the standards they are teaching throughout the school year. All assessments should hold the three characteristics of validity, reliability, and fairness. And with the passing of No Child Left Behind, combined with the Individuals with Disabilities Education Act, all students, regardless of race, gender, academic, or mental ability, must take state-issued tests and be held accountable for whether they have met the predetermined qualifications of being proficient or below proficient in the tested subject areas. Testing accommodations and modifications. Educators use the words accommodations and modifications as if they are the same, when in fact they are actually very different, and if used improperly could do more harm than good. Testing accommodations are changes to the test in the way the test is given other than the way it was standardized. In other words, providing accommodations for students with disabilities evens the playing field by allowing the students to demonstrate what they know without being hindered by their disability. Modifications are changes to the test that would change what the test was actually supposed to measure. For example, an accommodation for the upcoming ACT could be extra time. Although the test is already timed, the test does not measure how quickly one completes the test. So having an accommodation of extra time will not change the test and what is actually being measured. On the other hand, having a modification of oral administration for reading selection that is intended to measure the meaning of the text would change the intended meaning of what is being measured and would not be an appropriate modification for this test. Although there are many accommodations and modifications available to students with disabilities, providing extra time for the student to complete the test, administering the test orally, and providing alternative settings for students to complete the test are the three most common choices selected. These are also the easiest accommodations to provide the students without interfering the student's ability to demonstrate knowledge and skills as well as student growth. Causes for concern. Assigning accommodations and modifications for high-stakes testing is not as easy as it seems, and some accommodations and modifications in place for the classroom setting prior to testing may not be the ones best suited for these particular tests. There are many factors that must be considered before holding a student, teacher, school, or district accountable of student performance, especially when accommodations and modifications are concerned. Research has shown that some testing accommodations result in different score changes on assessments for students with disabilities, but not because of the accommodations themselves, but rather because of the inconsistency in the use of accommodations. Identifying and classifying students with disabilities are vastly inconsistent across states, districts, schools, and even classrooms. In other words, a student could be classified as low vision and provided an accommodation of extended time and large print text in one academic year, and then the same student could move to another state the following academic year and be given no accommodations. If the student gained academic growth on the test with accommodations, is it because of the accommodations, or is it because of the skills and knowledge the child learned during the school year? If the student did not gain academic growth, is it because the accommodations were not accurate, because the same student was not provided accommodations the following year? Or was it because the student did not gain knowledge and skills necessary to gain academic growth? There's also the concern of moving students in and out of special education programs. A change of placement such as LD to autistic, late diagnosis of a disability, or early exit disabilities such as speech or language impairment also affect test scores and academic growth. Some states even offer partial participation in testing, where students would take tests on some content areas and not test on others. They can test out of level, where the student may take part of an assessment on a lower grade level than a student actually is, or even take an alternative assessment where the student would take certain tests based on the student's academic abilities. Results from these tests would inaccurately measure a student's academic growth, which would then lower reliability and affect test accountability. Some accommodations and modifications are considered unfair and even risk changing the difficulty of the test items and increasing the validity of how test scores are interpreted. Students take high-stakes assessments multiple times throughout their school years, some with accommodations and some without. Those with accommodations would typically show improvement, but this is not always the case if the wrong accommodation were in place at the time of testing, or the tests were designed to measure accountability and not student growth. Misrepresenting groups by not measuring student growth can lead to inflated results, which falsely indicate that educators can produce results even with those who have disabilities. Some schools not only inflate scores, especially if state funding is tied into state test scores, but also provide incorrect data via clerical errors or hold students back intentionally to have students test on a lower grade level. Not only falsely acquires funding, but also cannot validate the accommodations that were used. Results. Under No Child Left Behind and Individuals with Disabilities Education Act, all students must take high-stakes tests regardless of his or her need for accommodations, race, gender, socioeconomic status, etc. Although accommodations are offered, not all students can use the same accommodations the same way. Just as all students are different, accommodations are different too, and should fit the student and the way he or she learns. Providing too many accommodations can hinder a student as well, because a student may not need every accommodation offered. But with too many to choose from, it would be impossible to know which accommodation was in fact the one that was most beneficial to the student. In order for an accommodation or modification to be considered valid, the accommodation should not benefit students without disabilities and harm those who do, but instead should help a student compensate for his or her disability by best demonstrating his or her knowledge. Although it is important to have accommodations and modifications in place prior to high-stakes testing, it is vital to have the correct accommodations and modifications in place. It also should be understood that just because some accommodations fit in a classroom setting, there is no reason to assume that those same accommodations would be necessary or even valid at the high-stakes testing level. Research on the effects of accommodations during high-stakes testing has been conducted, but little conclusive findings on whether they are actually fair and accurately measure student knowledge and skill levels have been established. In conclusion, until researchers find a way to separate the accommodations and actually provide evidence that specific accommodations do measure academic growth for accountability, the research will need to continue in order to prove the reliability, validity, and fairness of high-stakes testing with accommodations.